screen. Is everyone able to see my screen?
Yes.
Perfect. All right. Well, I'm going to hand it off to Maria now.
All right, good morning, everyone. So like Stephanie said, we're gonna be going over some questions that we've received from some of you to obtain clarification about the DAYC process. Okay, so we're gonna go ahead and get started.
All right, I'm going.
There you go. So how do I fill out the visual score chart? So that's one of the questions we received, and we're gonna go ahead and take a look at that and also give you some examples so it's easier for us to understand. So basically, we're gonna be placing a check mark, okay, in the corresponding picture, corresponding box based on the score for each of the domains. Okay, so it is important to remember that the scores listed are the scores that are on the right-hand side of section 3, and those scores have to be the same. Basically, they have to match what is on the table. Okay, so we're going to be looking at 2 examples following, actually 3. So as you can see, the social emotional standard score for this kiddo was 58, right? So we have to find the social emotional column, all right? And we're going to be looking for 58 score, okay? So that's where we're going to be adding the check mark, all right? In this case, it will be right here. Exactly. So which is indicating that the child doesn't have yet the skills appropriate for his age or expected for his age, or he is functioning like a much younger child, okay? Let's take the communication standard score is 72. So we're going to be looking or locating the communication column, okay? And then we're going to be looking for the 72 score or range. And as you can see, is right there. So that's where we're going to be adding the check mark for that specific domain for the communication, which 72 is indicating that, you know, it is an emerging, that the child is using a mix of skills, some of a much younger child with some occasional skills, which is indicating that he's closer, getting closer to his age level, but he's not there yet. Okay. For the cognitive, we have standard score as 78. So we go and look for the cognition column, and then we look for the number 78, and then we'll add the check mark there. Okay, so for the cognitive domain, with the 78, it's indicating, okay, the child now is using some mix of age expecting skills and some that are not at age level, okay? So this is a good visual for you to remember that those numbers need to match what is on column, on the column on the section 3, okay? So they really need to match. Any questions about this? I mean, it's pretty straightforward. It's just plugging the scores into a visual chart. Any questions? No? Okay, perfect. Next. So how do I use informed clinical opinion, which we usually refer as ICO? So basically, we use informed clinical opinion when the child is not longer eligible for services, but we feel that the child should continue being eligible for services if there is a need of continued, you know, support. So you can think, okay, how should I do it? When should I use ICO? So it is important that ICO can be used when you don't see that the scores are actually reflecting what the child is doing. You can also use ICO when there is a significant gaps between subdomains. And this is a great example for the communication domain, in which, you know, is divided by expressive and receptive. If there is a significant gap between those subdomains, you can definitely use ICO. Same for the fine and gross motor domain. It is, divided by those subdomains. If there is a significant gap, you can also use ICO. Okay. Again, if you feel that the family continues to need support to carry out those strategies during the daily routines, and also if the child is really not meeting those milestones yet, and you feel that he needs that extra push and assistance to continue progressing and meeting, his goals. Next. So when using ICO, again, that's what we call informed clinical opinion. It is important that we clearly state the reason why we're using ICO. Reference observations, always having those conversations with the parents, using assessments, interviews, any diagnosis, medical history, all of those documents that will help you outline the reason why you believe the child should continue to qualify for the program. Okay. You can always ask yourself, what are age-appropriate skills the child should be doing that they're not doing? And again, all those things, you can always add those descriptions, those skills, those challenges, into the documentation that you'll be using to indicate the reason why you're using ICO. How much support does the family need to carry on these strategies? Is the parent pretty successful and actually carry on these strategies in a daily basis? They feel comfortable carrying on these strategies without your support as much as they did initially. So again, having that conversation with the parents, understanding where they at. Remember, we're a coaching model. So having those conversations with the parents and also understanding where the child is developmentally. Okay. Next. All right, so basically, we're going to look at some examples. This is the eligibility redetermination section. So right here, we selected, just for the purpose of this training, we selected to check off the continue to be eligible due to clinical opinion. So the results of the DAYC indicate a borderline delay in child's communication skills. Based on informed clinical opinion, the child qualifies for the early steps program due to a gap between her receptive language skills, in this case 88, and expressive language is 69. The child has limited words and phrases to communicate. So this is a perfect blurb because you're not only adding the scores, but also adding a little bit of a description of what the child is doing at this point. The second example, again, we checked off continues to be eligible based on clinical opinion. The child qualifies for the early steps program due to minimum attention to task, which requires frequent redirection, difficulty transitioning between activities, and inconsistent use of two-word phrases. So again, you don't always have to. You will need those gaps in order for you to qualify the child based on informed clinical opinion. If those gaps exist, of course you're going to add them. But again, including a description, including the reason why, it's stating, and indicating those skills the child is having difficulty with. The important thing is document the reason why you believe informed clinical opinion is needed. Always document the reason why. All right, Steph, next. So I just completed a periodic. Yes, Paola. Paola has a question.
Hi, it's a comment. Sorry. No,
Yeah.
it's just that because I've talked to some providers regarding the informed clinical opinion, and there's sometimes that when you're doing the assessment and the scores are high, and then we also need to remember that this program is for children that are showing a significant delay. So sometimes the delay is very minimal, and that doesn't justify the child to continue to receive services. So that's something to keep in mind, that we don't have to continue with all the kids, because if they've met their goals and they're age appropriate, we don't have to justify for them to continue if they don't no longer need it. So that's one. And then the other is sometimes the scores are high, right? But like Maria said, You can use your informed clinical opinion because there's some things that are off, right? Like there's a gap between or a discrepancy between expressive and receptive or something like that. But you also need to look at when the scores are not qualifying the child, you also need to look at that frequency. Does it require to keep the same frequency as once a week, or could it be decreased to 2 times a month or something like that? So those are things to keep into account when you're using also the informed clinical opinion. That, you know, doesn't mean that we have to keep all the children because they have to need the program, basically.
Exactly, Paul. Yes, and we're gonna be touching on that, on making those adjustments for services. If the child continues to be eligible, we can always decrease services and maybe just close the case. But yes, Paul, thank you for your comment. So another question, I just received a periodic, I just completed a periodic or annual review, and the child's scores don't qualify them anymore. So now what do we do? So again, we're going to be using ICO, informed clinical opinion, if there is a need for continued services, and indicating the reason why, the services should be still provided, and then we're going to be viewing the frequency and the intensity of services, like Paola just said. Okay. So again, we're going to think, okay, what is the child doing or not doing that is age appropriate? Okay. And we're going to be studying some cases right here following the next slide. And we're going to be, let's take a look at Johnny. So Johnny entered at 18 months with communication delays. Okay. He was recommended ITDS 1 time a week with speech consult monthly. Now the scores are showing borderline delays in communication. So we'll use ICDO to determine eligibility, but we will decrease services as the family is needing less support to carry on strategies. Okay. So in this example, let's see what the justification to decrease services is going to tell us. So now Johnny is scoring a borderline delayed in communication. So the total score is 73. Okay, and he got a score of 80 in his receptive language skills and expressive 65. So there's still a significant gap between those two. But now he's increasing, the use of words to make requests. He is beginning to combine words. He is increasing his attention. So he is making progress and gradually getting meeting his goal. Okay. So now we can think, okay, does he really need ITDS once a week? Does this family really need that support every week? So that's where we need to think about those things. Okay, maybe he'll and the family benefit from maybe ITDS twice a month, and also, speech consult quarterly instead of doing it every month. Okay, so we need to review the intensity and frequency of those services, not only the ITDS, but also the consults, just to, continue supporting the family, but also allowing the family to continue proving themselves that they can do these things at home without your continued support. Okay. And next step. So how do we make changes to recommended services? So in order for us to increase services, we have a form, okay, that must be completed and sent out separately. But if we're decreasing services, we just sent an email to the SC adding a justification for change of services. And we're going to be exploring the form. We're going to be looking at the form to increase services, but to decrease services, you really have to send out an email. There is nothing really formal about it. It's just indicating the justification why. Okay. And this is another example of justification to decrease services. Johnny scored borderline scores in communications. The total score was 73. Then the receptive was 80, and then the expressive was 65. And again, he's increasing the use of words. He is beginning to combine words and things, increasing his attention. So again, now we can think, okay, Johnny is really, really moving along. He's not there yet, but he's moving along. So maybe we can decrease services for ITDS twice a month. And let's say it's speech consult one time every 4 months. So again, you get to know your families, you get to know their child, you know, and where they at. Okay. If they still, you feel that they require your support every week, same with the child, same with the consults, you know, those are things that we need to consider when we are increasing or decreasing the frequency of services when we use the ICO. Okay. Next, please. So this is the form that we'll use to request for increase in services. It's pretty straightforward. You ask for the name, the child's name, date of birth, the description of, you know, the child's skills, what are the challenges, what the child is having difficulty with, the domains, the recommended change, what are you requesting this change, justification, includes the outcome as well, any supported documentation you want to include with this request, your name and the date. So it's pretty straightforward, and this needs to be sent out and just complete it and fully completed. That way you can, you know, all the fields need to be filled out. Okay, the next slide, we're going to be looking at what's the difference between current outcomes and new outcomes. Okay, so the current outcomes basically are the outcomes listed on the IFSP. So basically, it is the same outcome listed on the IFSP. The outcome must be identical what is on the IFSP. You're not revising, you're not rewording, you're not rewriting, you're using exact the same outcome that is listed on the IFSP. And again, in this section, you're going to be reporting on the status of the outcome. You know, if the child did it, if you're still making progress, if the child needs to be, or we need to make adjustments, the outcome is not longer needed or is postponed. Okay. So current outcome is the same as the outcome that is listed on the IFSP, is identical. Okay. Next step. And the new outcome is the one you're going to be creating, is the new one, is the one you're going to be adding onto the child's report. Excuse me. This outcome is not listed on the latest IFSP. This is the one you're going to be creating. It's kind of like an extension of the current outcome in which you can include, you know, definitely some of the skills. But again, this is a completely new outcome. It's not related to the current icon, current outcome. Okay, so they're two separate things. Okay, the current outcome is the one that you see on the IFSP and is exactly the same. The new one is the one you're gonna create. It could be an extension of the current outcome, but it's something that an outcome that you're gonna maybe add new skills to it. You should, because they're new skills that you need to work on, the child needs to work on. Okay, so that's the difference between new and current. Okay, any questions about that? I know there might be some confusion about the current and new outcome. Any questions? No questions?
Yes, Maria, I have one question.
Yes.
I'm reading right here, but the new outcome should not be identical to the current outcome, but can be an extension of the current outcome or target different skills. It has to be different skill, or I can target the same, but in a different way. I don't know. It has to be different.
It could, yeah, I will say it could be an extension, or it can target different skills. Remember, the child is going to be older. So those skills are going to be older. Again, depending on how the child is functioning, at what level the child is functioning. So you can reward it differently. Again, using maybe, okay, the child will be using gestures, but okay, that's something in the old outcome. In the new outcome, he'll be using gestures combined with vocalizations. You know what I mean? So you can expand on that. You can expand on that specific outcome. So you can use words from the current goal, but you can expand to target those new skills you'll be working on. Makes sense?
Perfect. Thank you.
Thank you. Of course. Thank you. Thank you, Steph. I think we're good. You're okay.
All right, so why am I being asked to break up my outcome? So each discipline needs to have their own outcome. So for example, a speech outcome shouldn't be combined with a motor outcome. So if we are recommending consult, the same, we need to have separate outcomes per discipline as well. So if we're recommending speech and OT consult, we need to have a speech outcome, and then we need to have a separate OT outcome. If the goals are combined, how will we measure progress? So just something to kind of keep in mind when you're creating your outcomes. So now let's look at some examples. So here we have Johnny will combine 2 or more words to ask for desired items during mealtime and will begin to walk upstairs while holding onto the rail or an adult's hand. So here we see we have a combination of both speech and motor outcome. So we need to break it up. So the first outcome would be Johnny will begin to combine 2 or more words to ask for desired items during mealtime. That one is just focusing on communication. And then the second outcome, Johnny will begin to walk upstairs while holding onto the rail or an adult's hand while on the playground. So now that one is just motor outcome. So making sure that those disciplines are separated, because again, how are we going to be measuring that progress if we're combining those different disciplines? Sometimes we see some skills overlap. So sometimes, for example, communication, we could be working on, let's say, joint attention, but maybe, for speech, but then we also maybe have like an occupational outcome where they're also working on attention and similar skills. So there may be that overlap in skills, but still making sure that we're having those 2 different outcomes. So if the outcomes are combined, how will we measure progress? What would happen if Johnny can start to combine those 2 or more words, but he can't walk up the stairs? So in this situation, we would continue working on the outcome, but we wouldn't accurately represent Johnny's progress of he's, increasing that communication, but because of the motor is still something that we're working on, we're still continuing that goal. So we need to make sure that we're separating those outcomes so that we can accurately represent Johnny's progress and continue to help his overall development. If the current outcome needs to be identical to what is listed on the IFSP, how will I break it up? So I know that there's been questions, for example, if the case was passed on to you and the previous ITDS maybe combined the outcome and now you're being asked to break it up. So in this situation, you would discontinue the current outcome and introduce 2 new outcomes. So the current outcome, Johnny will combine 2 or more words to ask for desired items during mealtime and will begin to walk upstairs while holding on to the rail or an adult's hand. So when we're reporting on this outcome, we're going to check off no longer needed. And then when we add our new outcomes, we're now going to add the broken up outcomes. So Johnny will begin to combine 2 or more words to ask for desired items during mealtime. And then the next one, Johnny will begin to walk upstairs while holding the rail or an adult's hand while on the playground. So that's how we would be able to break it up. Of course, if by this time Johnny is now combining 2 or more words, then we could switch it up, make those changes as needed, maybe combining 3 or more words, whatever the progress is. Any questions with this? So the next question, when do I need to add new strategies? So I know that this one can be a little tricky. So I tried my best to break it up in an easy way for us to follow. So if we are marking off on our outcome that we are making progress, that means that we're going to continue working on the outcome. So we need to add new strategies. If we're making an adjustment, so we are making a slight modification to the outcome, whether we are adding or changing keywords, for example, we need to add new strategies. And if it's a new outcome, so something new that we're going to begin working on, we need to add those new strategies. So those are the three options where you would need to add those strategies in. For no strategies needed would be if you marked off, we did it, meaning that the goal has been met. No longer needed, meaning that the outcome was not met and we will no longer work on it. Or it's been postponed, meaning we didn't meet the outcome, we will take a break and then target it later in the future. So for those three, we wouldn't need to add new strategies. So just try to break it up in a way that it's easy to follow. Any questions with strategies? So when keeping the current outcome, do I change the goal, the strategies, or both? So yes, the 3 and 6 month goal are going to be updated to reflect what the child should be doing based on those current skills. And then the strategies also need to be updated to further support and expand on the child and family skills. So thinking about it, you introduce this outcome and the child and family still haven't met it within the 6 month mark, we need to add different strategies to change things up. So what are we going to start doing differently these upcoming 6 months to ensure that within this time frame, the family and child are meeting these outcomes? Because the strategies that we had beforehand, they only got us so far, so we need to change it up to give family new strategies and new suggestions. So again, what else are we going to do to further support that progress? How do I incorporate a new outcome, keeping in mind previous goals? So outcomes should be specific, observable, and measurable. We've been speaking about outcomes, and there is going to be an upcoming outcome training in the upcoming months, perhaps, where we'll be going over outcomes a little bit more. But when we're creating those outcomes, consider what skills a child currently has, as well as what is age appropriate for the child. So if the child is, for example, let's say 12 months old and we're looking at adaptive, we're probably not going to be seeing if the child is able to, let's say, start helping with household chores. We're not going to start looking at those more advanced skills. Of course, if the child has those advanced skills, that's great. But again, keeping in mind what is age appropriate for the child at that moment. So for example, if a child worked on single words to request for a desired item and has now met the outcome, the next outcome can focus on combining 2 to 3 words. So similar to a question that was asked a few minutes ago, where we're just expanding, we're still working on that communication, on increasing those words, but now we're asking a little bit more of the child. Where do I write a paragraph detailing the child's progress? So the DAYC report was created to make everyone's life easier. We tried to make the form as simple for everybody. And we can identify the child's progress by looking at the functional area section. So that area in section 3, where you are documenting the child's current skills. So Johnny is able to do blank, blank, blank. Next steps are for Johnny to blank, blank, blank. And then we're also looking at the status of the current outcomes and then the introduction of new outcomes. So based on that information, we're able to see if Johnny is making progress or if we're kind of at a standstill. So there is no space to add a paragraph where you would be adding like a summary of the child's progress. because we don't need it. If there is something important that you want to share with the service coordinator that you feel is beneficial for them to know, you can always add it to the body of the email when you're sending your DAYC report to them. Any questions so far? So what is the DAYC outline and what is the purpose? So the outline looks at all the different areas of the DAYC report. It breaks up every section so you can go down and look through all of the 7 sections. And I recommend for you to take a look and complete it on your own DAYC report before you submit it to the service coordinator. We'll be looking at it shortly, but it pretty much is a guideline to make sure that you are including all the components into your DAYC report. Service coordinators and myself are going to be completing checklists on certain DAYC reports. So if we notice that corrections are needed, then we'll be emailing you and requesting, sending you the feedback and then asking for the corrections to be made and then sent back to us. So it's kind of a process. So hopefully, by you taking that extra step and completing the DAYC outline on yourself, you're able to catch those mistakes and make the correction before you submit it to the service coordinator and we have that back and forth emailing. So now let's take a look at, and then please making sure that we are submitting our reports on time or early. And then this would also allow enough time in case those corrections are needed. So now let's take a look at the outline. So again, it's looking at all of those areas. So it's looking at, making sure that the child's information is listed, that all the boxes are filled out, that the chronological age is filled out, that the score is listed on the far right, that we are filling out the visual chart. So it looks at all of those little details, all those little components that are needed for the DAYC report so that you can use that as a guide. And maybe as you're going through it, you say like, oh no, I forgot to, check off this box to indicate that there's a delay in this area. So those little reminders that you can catch yourself before you submit it to your service coordinator. Any questions?
No questions.
Thank you. So I have presented the caregiver with the DAYC report, but they are unable to sign it. Now what? So if the caregiver is unable to sign, you can send them a text message or an email where you are confirming with them that you went over the DAYC report, that they were given a copy, and that they're confirming essentially that it was received. If we receive a DAYC report that doesn't have a caregiver signature, then we will be returning it to you so that we can have that signature. But of course, sometimes there's some parents that maybe aren't able to sign it, or we're sending it to them via email. So in those situations, you would just send that text message or send that email and then attach the screenshot with your DAYC report. In the most recent DAYC report that was sent earlier this month, we did add this little blurb to the bottom that you could copy and paste into your email or copy into a text message of you sending to the parent, which pretty much says that today we went over the child's DAYC report for the IFSP review. Please confirm if you agree with the findings of the report and outcome by responding to this text message. So let's look at an example. So when you're completing your DAYC report, in the parent caregiver signature box, you would just write like see text message or see email, and then you would also be attaching a copy or a screenshot of that communication, whether it's a screenshot of the text message or a screenshot of the email where the family is confirming that they received and reviewed the DAYC report with you. Any questions? Great.
I
I have a question. You see,
Yeah,
based on
course.
what you just say, my dear, I have to do exactly as the photo was showing, just like that. I mean, where the parents, where the parents are supposed to sign, of course, nothing will be. So I just add the test in the way it's showing right there in the picture.
Yes, yes, and you can make a little note on the parent signature line, like see text message or see email, but then
Okay.
also attach a copy of that communication, whether it's the email or the text message where the family is confirming.
So this plus we used to have, we not used to, but we send a complete page with the test. You also want that, yeah?
Yes, correct.
Okay. Okay, thank you.
Yeah, thank you.
Stephanie, I have a question.
Yes, of course.
After this meeting, I had to meet with a mom to complete a periodic review. So I'm going to bring the paper, the reporting paper, so she can sign the report. So
Perfect.
I'm going to send this as I'm going to scan this report, and also I will send this test in Word version, right? Correct, but the Word is gonna be without the signature, only the PDF. Is that? It can be like that?
Yeah, so as long as we have that copy of the parent confirming, signing that they
Sign.
received, yes, that you reviewed it with them and that they saw it, confirming.
Yes, she will sign today this, and I will send this. I'm going to scan this document, and I will send also the report in the Word version. So that's okay.
Perfect. Yes, yes, perfect. Thank you. Good questions. So I need more help. So what can we do if you are ever feeling stuck in any situation? Let's say that you're completing the DAYC report and you're stuck, or you're completing the DAYC. You can always reference our YouTube page. We have broken up all of the different domains in the DAYC, broken it up by age. So you can see if you're working on, let's say, adaptive at 12 months, we have a video for that. Or if you're working on communication for a 9-month-old, we have that. So everything is going to be on our YouTube channel. If there are any DAYC report specific questions, you can always feel free to reach out to myself. I know that Paola is also available, but just know that we are here to fully support and provide any help, any guidance. I know that it's been a transition, and we definitely appreciate all of the hard work that you are all putting in and adapting to all the changes. But we're here if there's anything that we can definitely help with. Any other questions?
I have a question.
Yeah, of course.
Which is in reference to a review that I'm working on right now, but it also attached to situations that I have gone through before. And I mean, to fill up the application and the report, that's great that you gave us all these cues, but to determine how to proceed in each case, it's something that has been the biggest issue for me, to determine that each child is different and there are situations. I have been blessed to have Paola, who has been helping me. I appreciate that big time, and she knows it. But could be nice that you guys also address a little bit, like when the child is premature, or the fact that if the child is receiving other services, speech or OT, they can also help us to determine if the child can continue going or not in the program. Because sometimes the kids have all those numbers and the numbers are high, but not necessarily represent what the child is at the moment. Like right now, I have a little one. Her numbers are age expected. I will say four of the 5 domains. One of them is 84, which is adaptive, and she's at the very borderline. She's 84. is a bright child, very smart, but she got anxious when she's away from mama. She got anxious when she's away from the nanny. And I'm here thinking, how should I present this case? Because her mom wants to keep going in the program. I see the benefit that the child can benefit from it, but how do I present that case? Her scores are high, quite high. Only one is, not there yet, but it's also high, even though it's not there. And her emotional area, which I understand is one of the most important areas, is how it is. How should I proceed in this case?
Yeah, no, that's a really great question. And like you mentioned, every child and every family is different. We have to make sure that it's very individualized. In this situation, I would use, you presenting the DAYC report, presenting those scores to the family as that opportunity to have that conversation. Hey, mom and dad, these are Johnny's scores. This is where he's at. He's showing that appropriate age development in these areas, but we're seeing this delay in adaptive, the things that are bringing him or her down are, that separating from you, maybe not being able to calm herself. So presenting those examples of why we're being a little bit lower on that adaptive, and then providing them with recommendations. Right now we're doing ITDS one time a week, but these are the strategies. These are things that you can continue working on with them at home. Do you want to continue with one time a week? Do you feel that we can start decreasing? As well as asking about the support that they're receiving through other services. So maybe they're receiving speech or OT, via insurance, at the clinical setting, and asking them, what support are they providing you? Sometimes there are some speech therapists, some occupational therapists, or physical therapists that are very family friendly, in the sense that they provide family with those additional resources and strategies so that they can continue that progress on at home. And that's great. That's awesome. But then other times there's other therapists that they just take the child in, and they do, the therapy, and then they send the child back, and mom and dad have no idea, what the therapist was working on with the child. So having, again, those conversations with the family, how much support are you currently receiving? How much support do you still need to carry out those strategies? And taking into consideration each family. If these are things maybe that we're only seeing during the nighttime routine when you're not present, giving the family more strategies, more suggestions on what they can do during that time, again, because you're not present during that time. So having those open conversations with the family would be probably the best suggestion there.
Okay, so do you think this child could be a good candidate to continue or no?
That would be, your opinion, asking yourself, what is
I think that's needed. My point is how do I present that because of those high scores? I mean, that's where when I say that I has been like, like I needing support, and Pau has been helping me with that, is I know the child needs it. It's emotional area. Mom is happy with the service she's receiving. The service in speech, she doesn't go in with the child. So she's kind of relying on early step services.
Right.
I think to me, she does need the service a little bit longer.
Yeah.
Now, I'm going to present it, and I'm going to go not 4 times a month. I may go twice or once a month.
Yeah,
that's part of the
definitely.
changes that I'm thinking on doing.
Yeah. And let me ask you, how old is the child?
Oh, she's 19 months old.
19 months. Okay. What is thinking about a, typical developing 19-month-old, and the milestones that a typical 19-month-old are or should be doing? What skills is she still needing support in?
she's doing really good, honestly. It's just this emotional thing that is going on and sometimes, her behavior became a little bit, tantrums and those type of things that confuse mama. I would say.
Yeah, okay. Are those behaviors preventing her from completing other skills? Like, does it take her a long time to like self-regulate? Is it that she's like, not communicating and it's leading to those tantrums?
No, I think she's doing really good. I think it's more a matter of being in maybe mama being controlled, maybe the little ones have, something in her that needs to be addressed or watched eventually.
Mm-hmm.
At this point, she's very little. I mean, she's only 19 months old, and she has been progressing beautifully. It's just that, I mean, sometimes there are things that we cannot define. I don't know if I say that correctly, but I don't want to take too much of your time. I just needed to bring this up to see if you guys can guide me in this.
Yeah, no, not at all. These are really great questions. And I would say, in this situation, really break down what it is in that social aspect that she still needs that support in. If it's that separating from a caregiver without crying, is it, that self-regulation where she's able to self-soothe herself, like really looking at that social area and then using that as your justification for informed clinical opinion. So, Johnny scored an 84 in social. However, due to clinical opinion, he'll be eligible because he is unable to separate from a caregiver in familiar settings. He's able to self-soothe himself, which could eventually, or which turns into tantrum behavior. So again, using those skills that he still or she still needs support in to justify your clinical opinion if you think that services would still be beneficial for this child, which it sounds like you think it would be beneficial for this family to continue receiving the support from us. Hopefully that answered your question.
I think you're muted.
Nubis, you are muted. Oh, we're good? Okay. Sorry, couldn't hear you.
Yeah, I say thank you and I appreciate your response. Yeah.
Of course.
And also, Steph, let me maybe add a little bit on that. Nubis, also what you can do is, within those suggestions, you can do, okay, mom, let's do maybe a play group every 2 weeks. Let's work on that social component, how she's going to be separating from you. Maybe let's take her to the library, kind of like working on the skills that you feel that she needs that extra support with. And obviously incorporating the family, because socially, the social component is the foundation of everything. So if she's socially, or if she's very anxious, and she, that's going to really impact her ability to maybe perform, so those are things that you can consider. And like Stephanie said, you can always use ICO based on those challenges and things that you're seeing that she's struggling with socially. And again, you can always suggest like those type of things that they can do as a family, to help her in that way. Yeah.
Oh yeah, absolutely. Thank you. I appreciate that. Yeah, I will have that in consideration. Absolutely.
Of course. Thank you. Thank you, Noris.
Thank you, Maria. Or any other questions?
Yes, I have a question, Stephanie.
Of course. Yes.
In the case of an outcome is postponed, I wondered when it happened. It doesn't happen to me yet, but I think it's when the services are placed on hold. When they want to place the services on hold, that's what happened.
So an example of an outcome being postponed let's say, for example, that we introduce the outcome of Johnny will begin to use, 2 words to request for desired items, right? And as we start that outcome, we realize that 2 words is too much for Johnny. Maybe we need to bring it back to 1 word, or we need to bring it back to gestures. So in that situation, you could postpone the current outcome of using 2 words, introduce a new outcome to focus on maybe using 1 word or using gestures, kind of like as that foundation. And then once Johnny meets that outcome, go back and reintroduce your postponed goal. So you can use it as a way to work on like those foundation skills if maybe we jumped too far ahead or there's something else that we need to work on. Maybe at the moment when we were working on the IFSP, families' concerns were feeding. So we created a feeding outcome. But now as we're continuing, mom and dad are saying like, you know what, let's hold off on feeding. Right now, our biggest priority is communication. So in that situation, you could also postpone the feeding outcome and then introduce a communication outcome. So postponing is more of, we're just going to pause on it for a little bit while we work on other things, and then we'll come back to the postponed outcome.
Oh, wow. I was totally confused. Thank you so much.
Of course, did that answer your question?
Excellent. Yes.
Okay.
Thank you.
Of course. No, really great questions.
Thank you.
I have one more question.
Of course.
In the case of the consults, when we make the consults, we have to write in the strategies that the specialists give it to us, or in that case, because I see they have a different new form too.
Yes. So in those situations, working with so let's say you're working with a child who has speech consult, right? So that situation, you would be working with that speech therapist to get those strategies to support your outcome. So we're using our IFSP as our book of strategies for ourselves and for our families, right? So working with the therapist that's providing that consult to get those strategies. So maybe during one of those consults, you ask like, hey, what are some other strategies that you can provide for me to help Johnny with communication, because these are no longer working. They would provide those strategies to you, and then you can add them into the DAYC report when you're making your annual or your periodic. Does that answer your question?
Yes, thank you.
Okay. Of course. These are all really great questions. Any other questions?
I'm fine on my side. Thank you. It was great.
Of course, but thank you all for taking some time and joining us today. I hope that this was helpful for everyone and you at least took some information from it. Like I mentioned, this is recorded, so I will be uploading it onto our YouTube channel. And then following today's meeting, I will send out a copy of the most updated DAYC report, of the outline, and then the link from today's meeting so that you can reference it later on as well. But again, thank you all for joining, and I hope you all have a great weekend. And of course, feel free to reach out if you ever need any support from any of us.
Thank you very much.
Thank you.
Thank you.
Thank
I
you.
appreciate it.
Bye
Have a
bye.
good weekend. Bye.
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 Bye.